Veterans Access Act of 2025. And so I'm trying to go over four pieces of legislation, two of which I support. The other two, I don't support the legislation, but I support the overall concept. And I'm hoping that something worthwhile will appear in the future. So this is about the Veterans Mission Act of 2018, which was passed in 2018. And since then, Veterans Health Administration has done everything they can to gut that legislation, specifically the community care, which are basically private practice providers that are not VA affiliated. They don't work for VA as employees, essentially. And they've succeeded in doing that largely because, and I normally don't get into political parties, but in this case, I really have to because it's unavoidable. Otherwise, I'd be pretending like something doesn't exist that does exist. During the Biden administration, basically, there was a concerted effort to essentially make it to where veterans were forced to go to Veterans Health Administration. And this is largely because the AFGE union donates money to Democratic candidates that are very pro their agenda, which is keeping veterans locked into Veterans Health Administration like hostages and forcing them to go there, whether they want to or not, whether or not they die or not, whether or not they're neglected or not. My experience, my observations is this is the way it goes. Now, thanks to President Trump's administration, March of 2025, the AFG union was largely gutted, so to speak. My words, not his. There was an executive order that was signed, is my understanding, which used an obscure legal law, legalese, legal precedent that made it to where about 90% roughly of the workforce were no longer going to be unionized, essentially. Money was going to no longer come out of their contract or their paychecks. The bargaining agreement was going to cease to exist. This is currently caught up in litigation right now. And evidently another union that's not affiliated with the VA has joined suit. So I'm hoping that they do not prevail because they are, in my opinion, a part of the problem. I actually used to be a union member, believe it or not. And I don't think that they're the whole problem, but they definitely are not helping the cause. And it's very complicated. I actually wrote a book on this called Veterans Affairs Whistleblower Retaliation. It's on my website, vanessaselect.com. If you want to go really deep on this topic, you can go there. I talked about the union a little bit there as well as all these complex issues. But the Veterans Access Act of 2025 wouldn't solve all the problems, but it would help with the fact that Veterans Health Administration administrators and employees do everything they can to keep veterans from knowing what their medical options are and from legally accessing them. And this goes from wait times to medical options, everything. The providers that are in the insurance network, the Optum is the name of it, there are very few of them across the country from what I've seen in multiple states now. And this is because they have done everything they can, Veterans Health Administration and their political allies, to sabotage it and demolish it by refusing to pay these providers, by refusing to pay them timely. When they ask for an authorization for medical treatment for their patient, they don't respond. It takes months and months and months if they ever respond at all. And it's basically just a total nightmare for the providers and also for the patients trying to access it. So Veterans Access Act of 2025 would help to address some, but not all of those issues. It's definitely a step in the right direction. So some of the key highlights, this came from the House Committee on Veterans Affairs, Chairman Mike Bost. Veterans Access Act of 2025. Go in the description of this YouTube video if you're watching this on YouTube. And I copied and pasted the links, the direct link to every piece of legislation I'm talking about, not just in this video, but in my other videos I'm going to be doing as well today. So Mission Act 2018 required VA to establish access standards for primary, specialty, and mental health care in VA medical facilities and through VA's private community health care partners. So those access standards for primary care are 20 days. On the 20th day, the veteran should be seen, and that is not happening all across the nation because Veterans Health Administration wants to steal the tax money, hoard it, and basically defraud veterans out of their health care. And that's what they've been doing for years, and they're continuing to do it right now as we speak. I'm actually in a situation like this, and I know another veteran that is as well, and it's a rampant issue. And people that work in the system know that it's happening, even if they disagree with it. They don't have the power to control it if they're like a physician, for example, because the administrators are ones calling the shots. So 28 days is specialty care. On the 28th day, the veteran is supposed to be seen for specialty care. That's basically, it could be anything from, it could be anything. It could be a mammogram, it could be a mental health issue, it could be substance abuse, it could be chiropractic, it could be anything. Dental is another example of specialty care. That's also not happening typically either. So the VA has undermined its own community care program, as I've already described just now. This is something that the VA has publicly acknowledged, that their goal is to reduce community care referrals and bring more care in-house. And this is all about money. So this is all about fraud, waste, and abuse from Veterans Health Administration. They employ more people that are non-clinical staff than what they need to employ, and they suck up as much money as they can. And then they go back to Congress year after year, whining and crying and saying they don't have enough money, and these veterans are so expensive, and you need to give us more money. And there's never any real accountability for all this money. That's just a slush fund for these administrators at Veterans Health Administration. And I'd like to point out, Veterans Health Administration, no matter how much propaganda that they pay to put out in their commercials and their billboards and their advertisements, is an evil organization with a bunch of morally bankrupt people running it. They're killing off veterans, and they're doing it because they want to make money and they hate veterans. That's what you need to know about Veterans Health Administration, that they're never going to tell you up front, but that's what you deal with if you're dealing with this organization day in and day out across the country. This is how they operate. And that's why Veterans Health Administration needs to have the power decentralized, so they can no longer call the shots and make decisions about veterans. And veterans need to be able to be empowered to make their own medical decisions so they don't get killed off slowly or quickly by this organization, which is what's been happening and continuing to happen right now. So they've slowed down, the VA has slowed down veterans' access to care and hinders the intent of the Mission Act by reducing veterans' healthcare choice. The Veterans Access Act of 2025 is required to ensure no future administration is able to prioritize bureaucracy over veterans' health options. Unfortunately, this is going to be a continued fight, because depending upon the ideology of who gets into office next, especially at the presidential level, and who the majority of people in Congress are, you're going to continue to have these issues of them trying to sabotage veterans and not have the choices that they need to have. Our government's massively corrupted, and it's really bought out by a lot of people, a lot of industries, like especially in the healthcare industry. Pharmacy benefits managers, the pharmaceutical industry is number one for contributing to all political candidates, both Democrat and Republican, as well as insurance companies. A lot of people point that out, specifically with Optum being involved in all this, about how much money Optum stands to make. And there is truth that the American insurance industry is absolutely awful. I don't doubt that. But when you have people dying because they're not getting the health care that they need, despite the fact that it's already been paid for, and there's this massive healthcare fraud being carried out in Veterans Health Administration, you really have to look at how you can immediately solve that problem and overhaul the system quickly. And the Veterans Access Act of 2025 is the only piece of legislation active and pending right now that even has the possibility of addressing that right now. So let's see. The Veterans Access Act of 2025 would continue to make the VA healthcare system more accessible and accountable to the veterans it serves. It would codify current access standards and prevent VA from manipulating wait times in order to limit veterans' access to care in the community. So that's a mouthful. So what they mean when they say codify is basically it would write it into permanent law, like legislation that would have to be voted on by a certain number of congressional reps in order to overturn it, just like any other law in the future. So it'd be a lot harder to basically screw veterans out of their health care moving forward than it is right now, because what Veterans Health Administration really is wanting and what they're hoping for, the people that run this organization, this department under the VA, is for a VA Mission Act 2018 to essentially expire. They're waiting for this whole thing to expire so they can just do whatever they want with veterans, hold them hostage, and never let them out again. In spite of all the limitations of the Community Care Program and the VA Mission Act and how they've been able to dismantle it, control it, manipulate it, and sabotage it, veterans are still racing out of Veterans Health Administration at record speed, because veterans most veterans, it's very safe to say, hate Veterans Health Administration. Like, they don't enjoy being there. The service is not good. You're not treated well. The medical malpractice is rampant. The medical neglect is constant. And you have a lot of people that are non-clinical staff, like admin people, who hate their job, hate the veteran, and are being employed and being paid all this money that they shouldn't be getting. Their jobs could easily be phased out with artificial intelligence because their jobs are really basic and repetitive. Further, this bill would establish a defined access standard for the provision of residential substance abuse and mental health treatment, recognizing that when a veteran in an addiction crisis decides that help is needed, time is of the essence. And this is really the case with a lot of things. There's a lot of healthcare where time is of the essence. And if you delay healthcare, if you delay people being able to get the screenings they need, the checkups they need, whatever they need, that things get worse and the outcome ends up becoming much worse, regardless of what population you're in or what country you're in. This is a known issue. Finally, this bill would require VA to be more transparent with veterans when they are deciding their best options for care, whether at VA or through a community-based provider. And I'm not 100% how they're going to enforce that, because right now, the Veterans Health Administration are not enforcing access standards as it is. I've dealt with this directly firsthand right now. So I don't really know what they're going to do to actually enforce these standards. I just know that the standards currently are not being enforced, and I've dealt with this directly as recent as yesterday. So here are the highlights of the rest of the Veterans Access Act of 2025. Having the choice for where they receive their healthcare, veterans, results in more quality healthcare options for the veterans, which I agree with. I mean, that's really any patient. The Mission Act is not optional. They're referring to the VA Mission Act of 2018 being a law, and that basically the VA ignores it all the time. We know this. If a veteran is denied access to community care, there should be full transparency into their options for care, reasons for denial, and avenues for appeals. That's not happening. Right now, what they do is they unilaterally deny it, even once it's approved right now, and there's legislation that to make it easier to access and to stay accessible to the veteran. What's happening is that they're refusing to send the authorization, which is basically paperwork, to the non-VA healthcare provider in the community. And that means that basically it sits there for months and months, or they'd never take action ever. And they hope that the veteran will just like forget about it essentially, or drop dead, because they don't want the money leaving the facility. That's what they're doing. So the veteran, what they have to do is they have to contact community care and force them basically to do their job. And I just was actually on the phone yesterday with community care in Columbia, South Carolina, the Veterans Health Administration, their main hospital out there. I was hung up on. I was told off by one of their MSAs, which is like a secretary, medical support assistant. So overpaid secretary should be laid off and replaced with artificial intelligence. And they were like, their party line is, oh, we just need more money and we need to hire more useless people, non-medical staff. And, you know, that's the issue. This is just so time consuming. We're overworked. That's always the party line, because these people are stealing from the taxpayers. Okay, that's what's happening here. So that's complete lies. It's complete trash. These people are barely working. They're off all holidays. They're off today, Thanksgiving. They leave at, I know it was a fact, Columbia, South Carolina, the VA main facility. They're out of there before 4 o'clock. They stop working before 4 o'clock. And I know because I've called over there. And I've been told this by their staff too. They're not in there at 5 a.m. They're not in there any earlier than 8 or 9 a.m. in the morning tops. Plus they take a lunch break. Plus they have all this paid leave. Plus all these benefits. So these people are barely working. And they're very entitled. They hate their job. And they hate veterans. So that's what's happening over there. And everything's very unilateral. So they do whatever they want. And they're getting away with it. So this is a great law, but I'm just curious how they're going to enforce it, because it feels like they still are giving too much power to Veterans Health Administration to just do whatever they want. The Veterans Access Act of 2025 would ensure veterans are educated on their healthcare choices and ensure they always have timely options for quality healthcare to meet their needs. So I think they're going to do everything they can, Veterans Health Administration, to continue screwing over veterans and defrauding them of their healthcare and stealing the tax money. But what's great about this is it is another tool where it moves the needle in the veteran's favor, which is ultimately the patient's favor, so they can get some health care and stop being abused by people that work at Veterans Health Administration. And so that's really key. Right now, they've got some really shitty nurses that work at Veterans Health Administration. I don't know what is going on over there. When I worked there about 10 years ago, I was told that they had horrible nursing staff, horrible nursing supervisors. I was even told this by one of my congressional reps in a different state. And I didn't know anything about it at the time because I really didn't have any exposure to that. I wasn't a nurse. But recently, I've had more exposure to Veterans Health Administration nursing staff, and I definitely see what they're talking about. So I don't know like why they're attracting such awful nurses, but they really have a real problem with their nursing staff at Veterans Health Administration. So something else to be aware of and to be on guard about. They also have way too many non-medical staff sucking up money, and that is a chronic issue as well. And these people are just absolutely worthless. So that's all I have for Veterans Access Act 2025. Please contact your congressional reps and tell them to vote for Veterans Access Act of 2025. Tell them to co-sponsor Veterans Access Act of 2025 and tell them to publicly advocate for Veterans Access Act of 2025 so it can be passed into law. I'm going to try to start doing more legislation, law, and policy veteran-focused videos because there are a few key pieces of legislation that pop up here and there that, if passed, would save countless veteran lives and improve the quality of life for veterans, which is desperately needed because Veterans Health Administration hates veterans, is going to keep killing them off and sucking up the tax money at every opportunity. And you need to understand that. Also, if you're a veteran receiving medical care at Veterans Health Administration, make sure you log on to va.gov and start reading your medical record because there's a high probability there's something in there that's false and you have the legal right to challenge that. All right, I hope you have a great day. Happy Thanksgiving. Bye.